I'm an orthopedic surgeon with a specialty in shoulder and elbow surgery. I do reconstructive surgery on pretty much infants to older people with degenerative problems, fractures, and things like rotator cuff tears, joint replacements, and things like that. In this particular case, I was confronting what we thought we knew about the problem. Published literature suggested that the changes in the bone, deformity, if you will, were exactly opposite to what I was suspecting. So I needed to overcome that hurdle and believe in what I thought I was seeing, the path I saw to improving her function and situation. The 3D model enabled me to get clarity on that, put the plan precisely, and explained it to the patient. You really need to know the anatomy thoroughly and have a full-fledged discussion as to what the objectives of the surgery are. Doing this in 2D is almost impossible. Even some sophisticated 3D technology, if you don't have access to a model that you can see in 3D, you can make miscalculations. To answer how this helped, particularly in this case, it's useful to put in perspective that the existing published literature got it all wrong, using not only 2D imaging, but even early 3D imaging, because I didn't have the advantage of 3D models. Sophisticated 3D scanners help you if you know how to use them, but you can get into trouble too, because the pictures you look at are ultimately 2D, and you can make miscalculations. I had written a paper a few years back that suggested that some of our thinking on what happens to these bones in the context that affected our patient was wrong, but I didn't have absolute confirmation. The 3D model enabled me to be certain that I was making the right decision and to plan for surgery where I could correct the problem with precision. Having the 3D model in hand, I could be very specific about what the surgical objectives were. It's a level of informed consent that really is unparalleled. But I could also translate the change in the shape of the bone to actual functions. She would be able to do more easily, things she might even lose a little bit of, which we did talk about, because there's an element of borrowing from Peter to pay Paul in this kind of surgery. She was extremely informed. She knew what the objectives were, and we were able to proceed together. The main limitations in conventional 2D imaging are that you think you know the whole story, but you don't. This is a fascinating time in my field and all of medicine, really, where we're able to visualize things that we spent most of our education and training trying to project in our minds what was happening with the limited information available. It was amazing how there were gaps that we didn't know about. In my treatment, it has to do a lot with fracture care, where you take an X-ray and you think you understand the fracture, but in 3D you can not only understand it completely, you can understand how your intended intervention is actually going to be feasible or not, or allow you to put things back where they need to go. The same is true for a lot of our joint replacements. Our implants fit in certain bones certain ways, and if you don't figure that out ahead of time, you're going to have a lot of trouble in the operating. The 3D model is revolutionary in my thinking and practice. I feel like I'm kind of discovering something almost every case. The limitations of how we were doing things before present themselves when you actually have the information in front of you. The 3D lets you wrap your head around the problem and see it from all different perspectives. It lets you plan the surgeries that you plan to undertake and how you're going to get access with the least amount of trauma to the patient. In orthopedics, we are trying to fix bones a lot. So if we, pardon the expression, skeletonize the bone, remove all the muscles and tendons, well, we can see it. And then we have a bone model in our hand, but that is usually counterproductive in terms of healing and function in the end. But if you can see the bone problem ahead of time, then you can plan a surgery with the minimal amount of trauma to get into the patient's body to fix things and put it back together. First of all, the quality of the model is better than anything I've seen in other areas. If they may exist, but I haven't come in contact with them. The ease with working with the company and the professionalism was exceptional, and there's a sense that there's a caring for your patient and for the product, and so it's where caring meets technology.